You're here every week. All right, so here's our first image here. First of all, obviously, we're gonna get them to change into a gown. They're gonna be dressed, nice and comfortable. So potentially right now, they're already tipped. These are post films, so we've already done the fluoro. She's uncomfortable. She wants me to speed through this. She's ready to get up and go to the bathroom. She feels a lot of cramping, like she's ill because we inserted liquid into her rectum. So at this point, we have filled it up completely. She really has to go to the bathroom, so we're gonna work really, really fast. All right, so first one here is 14 by 17. This is our AP. Not that way though, this way. And we want to be 40, SID. And I'm just gonna marry here. All right, so center for this one is at the iliac crest. So what are we doing? It's a KUB basically. So at the iliac crest.
Oh, okay.
Very, very simple here. A right or a left marker will suffice. You don't have to bend the knees because the tip is in, so we don't want to move her if we don't have to.
Ooh.
All right, so there's our first image. Very simple.
Okay.
Breathing instructions, I don't think I mentioned it to the last two groups. It's on expiration. So just like all the other abdomens. Yeah, so take a breath in, blow your air out, stop breathing. All right, so there's our first one. When you comp, you will only perform one oblique, but I'm going to demonstrate both of them. So in the book, there are POs and there are AOs. For our clinical sites, you mainly do POs, so that's why we demonstrate POs when we comp. So the one that you will do will be determined if I tell you to demonstrate the left or the right or the splenic or the hepatic flexure open and free of superimposition. So we know that the right colic flexure is also called the what?
The hepatic.
Good, the
Liver's
hepatic.
on the left side.
Yes.
Yes.
And
Yes.
then the liver's on the what side?
Your liver is on the right side.
Right.
Okay, good. I thought you said left for some reason. Sorry, I can't hear with all these masks on. Can't read your lips. All right, and then this left one over here is called what?
Splenic. Splenic. 'Cause it's-
Good. Which flexure is higher?
The right.
No, the left
left?
because it's
Because the liver is on the right.
yes.
Oh,
Okay. We have that big fancy organ over there. It takes up a lot of space. So it depends on which one you are actually trying to demonstrate. So for the POs, the opposite flexure is demonstrated. So if we're in an LPO, we're going to demonstrate the left flexure open and free of superimposition. If we demonstrate the right, we would be in an LPO. Okay, so it's opposite with POs. So it's going to be the upside. So
Okay.
RPO, you're going to be demonstrating this flexure. LPO, you're going to be demonstrating this flexure. Keep in mind, the book does have AOs, and you may have to perform an AO clinically. It's probably going to be super rare if you do, but I would highly recommend looking at the AOs because there may or may not be one on your image analysis quiz tomorrow.
Okay.
So I would for sure look at that.
That was like a wink,
Look
guys.
at that RAO.
Oh,
Yes,
that's what
look
you
at it.
put.
Yes.
In the email, you were like, look at the RAO. And it's like, the RAO what? Like,
Yes. The RAO, upper GI, and BE, I would highly,
Okay.
highly recommend looking at tonight for your image analysis quiz.
It's on there.
All right, so AOs, if we were doing them potentially, demonstrate the same side. So if you do an RAO, you're gonna have the right flexure open. If you do an LAO, you're gonna have the left flexure open. So what does this mean, open? It means that you can visualize it, that you don't have anatomy stacked on top of it. You're separating it so that you can see it.
Okay.
It's not really open. You just call it open or free of
Open
superimposition. Yes, we can see it, open to visualization. All right, so first one I'm going to demonstrate is the LPO. So we're going to bend this knee and bring this arm across, and we're going to push this under her. Sarah's really small, but if you have a bigger patient, like taller, focus on obliquing the lower portion of the body, not the upper. Remember, we're doing a lower GI now.
Lower GI.
Okay, so we want to oblique this side. So we are going to keep our collimation the same, 14 by 17. We have already changed out our IR. We're clean and ready to expose. So if we were in an LPO position, which flexure are we demonstrating?
Right.
Correct, the right. Good job, guys. All right, so if we're demonstrating the right, our center is going to be iliac crest and 1.5 inches off the mid-sagittal plane to the upside. So here's her mid-sagittal plane. We may want to go over a little more.
If you're going in inch and a half to
to
whatever.
the upside.
Okay.
Yep, to the flexure that you're demonstrating. So iliac crest, and then 1.5 inches to the upside off of the mid-sagittal plane.
Okay.
Everybody good?
Get it.
All right, so marker placement, we could do it right over here. Super safe, we would be on the pelvis. If you did a left, it wouldn't be incorrect. You just may be in some anatomy. Not pertinent, so you wouldn't fail, but you could potentially be over some of the bowel. So safer to mark on this side, the upside, which is the
Upside.
flexure that we're demonstrating. All right, LPO demonstrates the right flexure open and free of superimposition. This one is the lower flexure. So that's why we center at the crest. All right, so I'm gonna show you the other one, but remember, you're not gonna do these back to back for your comp. So, yep, good, thank you. All right, lean back, good. She's so small. Hold on, I'm gonna pull this out. I want you to scoot to me some. Okay, good. She's healthy,
Oh, my dummy.
She's dead now. All right, so we have a fresh IR in here. We're 14 by 17. Which flexure are we demonstrating here?
The left?
The left. The left is higher, correct?
Yes, so you need to be 1 inch.
So the book says 2 to 3 inches. The book says 2 to 3 inches. I'm gonna center 2 inches above the iliac crest and about 1.5 inches off the mid-sagittal plane.
So this one you do 1 inch, this one you do 2 because it's higher.
Because
So it's,
Inch and a half.
this one is at the iliac crest, 1.5 inches off the mid-sagittal plane to the upside. This one is 2 inches above the iliac crest,
Okay.
1.5 inches off the mid-sagittal plane.
Okay.
So still 1.5 inches off the mid-sagittal plane.
but it's just us.
It's the iliac crest because the left splenic flexure is higher, significantly higher because the liver's pretty big.
Okay.
All right, so we're in an RPO, which means we're demonstrating the left splenic flexure open, free of superimposition, and we centered 2 inches above the iliac crest. Safest place to mark here is going to be here. We would use a left marker if we marked here. If you wanted to use a right one for some reason, it would be over here.
But she'd have to have some light there, right?
She wouldn't necessarily, so you could put it right here on her. Like I said, for this one, what are we actually looking at? The left splenic flexure.
So we know that's
You're not going to be in pertinent anatomy if you mark over there, but you may see contrast under your marker. Because think about what you're actually looking at. So ascending colon here, transverse, splenic flexure is what we want to see right here, descending. So this may be filled up with contrast right here. But if you put your marker here, we're not necessarily looking at the ascending colon for this projection. We're looking here. All right, everybody good with that one? Good. Those are our obliques. So remember, still working with 14 by 17. Next, we are going to do an AP axial. So drop your legs for me. Good, kind of center out. Thank you. My nice, healthy patient. All right, so I'm gonna bring my tube down for this one. 30 to 40. You're good. You're good. 30 to 40 degree cephalad angle. So 30 to 40 up. You choose the angle. 30, 35, 37, 40. I'm gonna do 30. I'm gonna do the least possible.
Does that matter for a patient habitus?
It's supposed to,
Okay.
yes, but they don't do it clinically. We don't
Okay.
teach it clinically, so I would just say pick your poison, whatever's easier for you. If you have a steeper angle, what's gonna happen? You're gonna have more elongation. More elongation for the sigmoid colon.
yeah.
Collimation changes for this one. We are gonna go into 11 by 14 now. All right, change out the IR. Still gonna use a 14 by 17 because we don't have 11 by 14s.
Isn't there one that's 10 by 12?
Yes, the left lateral.
Okay.
Yep. So this one, we're still working with 40 SID. Our light is gonna appear much bigger than it actually is for beam divergence because I'm using a 30-degree angle.
So do we move, when we moving it back, do we move it to the 40 as well, or does that not matter?
What do you mean?
Like when you moved it back?
No.
So this is the SID, remember?
Okay, yeah.
That
This one.
40 is only for the 40.
That is only for when you stand up.
So-
So don't look at those numbers when
Okay.
we're on the table. We're gonna stay here, 40.
If I was higher up this way, she'd have to move that this way.
Yes.
And would you line the CR with?
You would actually line it up,
Oh,
yes. Yep. So make sure you marry here.
Well, yeah, I know. That's,
Oh,
it
would
like-
you line your CR up? Yes, we're about to do that.
Oh, okay.
So first thing you want to do is put your angle on your tube.
Mhm.
Once you move your tube and you touch this, you want to get married. So you're going to angle this. You are going to be out of marry. So make sure you check that.
And so it said to not marry with the line here, to marry with the actual Bucky, but I don't know if it's different.
Sure, sure. Probably preference.
Okay.
Preference. As long as you're married, I don't care. Either
I
way you
figured
wanna
the
do.
line would be the same.
All right, so it should be. So this one centered is 2 inches inferior to the aces. So I'm feeling for her aces here. It's very easy to find. Not that far. Good. So 2 inches inferior to the aces and mid-sagittal plane. So what are we doing here? We are going to blow this sigmoid up this way. We're going to elongate it to a nice S. So marker placement, right or left, either one.
So
She's very easy. Very, very
aces is that
What's-
front part.
Aces is the front part.
Oh.
Anterior, superior, ischial spine. So 2 inches and 2 inches inferior to that mid-coronal plane.
So
This
that's
is
the
the
immediately when you feel like right here, how
Yes.
you feeling for the,
Yep, not the iliac crest.
not just at the top, but
front.
in the front.
fronts. Aces. Yep.
Okay.
down.
Anterior, superior, ischial spine. All right. So like I said, right or left marker here, either one will do. Just make sure you're married. All right. Everybody good?
Same breathing.
Same breathing for all of them. Yep.
Okay.
Same breathing, same breathing. All right, last one. We're gonna take the angle off. I'm gonna come back up. Since I took the angle off, the first thing I'm gonna do is remarry. All right, collimation for this one is 10 by 12. It's very small, but all we're looking at here is the rectum.
We would change the IR to the 10 by 12 IR.
You can, or you can just say changing out my IR and you can use a 14 by 17.
Okay.
Preference completely.
Okay.
Preference completely. If you want to do that, do it. All right, so left lateral. So go ahead and roll for me. Good. Scoot your bottom back some. Okay, good, good, good. Right there. All right, so I'm going to make sure she's lateral here. Lateral as much as I can from this position at least. We are all married and we're 10 by 12. Center for this one, probably the easiest one. So you're going to just kind of grab the hip here. It's ACES and mid-coronal plane. So ACES is here. I like to grab like this. So I stay on track. Mid-coronal plane, I have to go to the head of the table to make sure I'm mid-coronal plane. Which I am, but she's not lateral. So roll a little more for me. So I'm gonna correct that. And then probably come back a little. All right, let me go back to it, sorry. Okay, good, I feel good about that one. Which marker are we gonna use on this one?
Right?
Right?
Left.
Left.
Left. It's a left lateral, so we're gonna mark the left side. So you can put a left marker here or here. Either one would not be incorrect. So left marker on either side.
Would you put it here if you're looking for the rectum? Would it be easier like put it up top?
So if you put it up top, you could potentially be in the rectum.
Contrast?
Yes. So I would mark lower. It's safer to mark lower here.
Okay.
When you look at the image, you'll understand too. It is, and it's pretty small. So your rectum, I mean, if I had to guess, your rectum is right here.
Okay.
So there's no way you can put it back here because she
You
said some light.
can, sure. Free
Okay.
light, yes, absolutely. Put it on the table. As long as you're mid-coronal plane and ACES.